Every time you push yourself up from a chair, your knees make that familiar grinding, crunching sound. You tell yourself it is just age. You accept it. But here is what that sound is actually telling you and why a single 60-second habit can change everything. That knee noise has a medical name: crepitus. When it happens without pain, it is usually harmless gas bubbles popping inside the synovial fluid. But when the sound repeats every single time you rise from a seated position, especially with stiffness or mild discomfort, it is your cartilage sending an early warning. Research shows that knee osteoarthritis patients have quadriceps muscle strength between 25 and 45% lower than healthy adults of the same age. The sequence is almost always the same: muscles weaken first, then comes the sound, then comes the pain. The sound phase is your window of opportunity. Here is why muscle weakness triggers that sound. Your kneecap, the patella, is held in proper alignment entirely by the tension of the quadriceps, the large muscle group across the front of your thigh. When the quadriceps weakens, the kneecap drifts slightly off track. The result is uneven contact between cartilage surfaces, producing friction and noise. The inner portion of the quadriceps, called the VMO, is especially critical. Clinical research confirms that selective VMO strengthening improves patellar tracking stability and significantly reduces both knee noise and anterior knee pain. A landmark meta-analysis covering 15,684 participants across 217 randomized controlled trials found that knee muscle strengthening exercises meaningfully reduced pain, improved joint function, and demonstrably delayed the need for knee replacement surgery. An 8-week quadriceps strengthening program produced significant pain reduction in approximately 60% of participants. Another long-term study found that the effects of consistent muscle strengthening outlasted both injection therapy and physiotherapy. These are not minor findings. They represent a fundamental shift in how we should think about joint care. The 3 exercises you need take under 60 seconds combined, require nothing but a chair, and carry zero impact on your joint. The first is the seated straight leg raise. Sit upright in your chair. Slowly lift one leg until it is parallel to the floor, keeping the knee fully extended. Hold for 5 seconds while breathing normally. Lower slowly and switch sides. 10 repetitions per side. This move contracts the entire quadriceps without placing any compressive load on the knee joint. It is the first exercise rehabilitation specialists around the world prescribe for cartilage softening and early degenerative changes. The second is the chair-assisted mini squat. Stand in front of your chair and lightly hold the back for balance. With feet shoulder width apart, push your hips back and bend your knees only 30 degrees, as if you are just about to sit down. Lower for 2 seconds, hold 2 seconds, rise for 2 seconds. Repeat 10 times. You do not need to go deep. Even a 30-degree knee bend powerfully activates the VMO, the muscle that holds your kneecap centered. Slightly turning your toes outward at 15 to 30 degrees during this movement has been shown to increase VMO activation further, compared to a forward-facing stance. The third is the seated heel raise with ankle circles. Still seated, raise both heels off the floor as high as possible. Hold 3 seconds, lower slowly. 10 repetitions. Then rotate each ankle in wide circles, 5 times clockwise and 5 times counterclockwise. This activates the calf muscles, drives circulation upward through the lower leg, and stimulates synovial fluid movement inside the knee joint. Think of it as lubricating the joint from the inside. Here is your 7-day plan. On day 1, do 5 repetitions of each movement to assess how your knees respond. On days 2 and 3, move to the full 10 repetitions per exercise. On day 4, add a second session in the evening. On day 5, extend the leg raise hold from 5 to 8 seconds. On day 6, turn your toes slightly outward during the mini squat to maximize VMO engagement. On day 7, check in with yourself. Most people notice a meaningful reduction in morning stiffness and knee noise within 4 weeks of consistent practice. Before you begin, a few important cautions. If you experience sharp pain inside the knee during any movement, stop immediately and consult a medical professional. If your knee is swollen or warm to the touch, seek medical evaluation before exercising. The exercises in this video are designed for muscle-related knee sounds in the absence of acute injury. They are not a substitute for professional diagnosis. Also consider that every kilogram of body weight lost reduces the compressive force on the knee by approximately 4 kilograms. Muscle strengthening and weight management work best together. Your muscles decline by roughly 1% per year after the age of 40. But clinical data consistently show that muscles respond to training stimulus. Regardless of age, meaningful gains are documented, even in adults in their 70s. If your knees are still at the noise stage rather than the pain stage, you are in the most valuable window possible. Start today. Every time you sit down, do 1 round. That single habit, repeated daily, compounds into a meaningfully stronger, quieter, more resilient knee over the weeks and months ahead. If this video helped you, please hit like and subscribe. We cover practical, evidence-based health content every week. Drop a comment below telling us how your knees feel right now. And check back in after a month to share what changed.